Life certainly is different now, but one thing hasn't changed, and that's no matter who you are, education has the power to bring out your potential, to propel you forward, no matter your background, where you are from, or what you want to achieve. At NBCC, we're still committed to hands-on learning and instructor-led education, whether that's in person or virtually through connected classrooms. Just remember, education knows no boundaries, and neither should you.
Good morning, everyone. Bon matin à tous. Welcome to this morning's Breakfast and Learn, Atelier de matin, presented by the Chamber of Commerce for Greater Moncton. My name is John Wishart, and I'm the CEO of the Chamber, and I will act as today's host and moderator. I want to thank you for tuning in this morning as we discuss a very important and timely topic, employee COVID testing and vaccinations, aux prises avec les COVID-19, tests et vaccinations des employés pour le COVID. Now, before we dive into the topic, I would like to introduce Erin Cushing, Coordinator of Entrepreneurship, Research, Innovation, and Experiential Education at NBCC. The Chamber is fortunate to have NBCC as presenting sponsor for the entire Breakfast and Learn series. And while we would normally be at NBCC Moncton this morning enjoying breakfast in person, we're pleased to be able to continue to present this virtual series. So I would now like to invite Erin to say a few words.
Good morning, everybody. Nice to be here with you, and hope you're all enjoying this great summer day. Nice to see it a little bit cooler out today. As John already said, I'm pleased to be here as representing New Brunswick Community College. And I'm really excited to say that we have opened up registrations for our fall cohort of our OASIS program, which is a small business mentorship program. So that is something that is of interest to you. You can find more information on the college website. I'll turn it back over to you folks. I look forward to seeing more from you. Have a great summer, and we'll see you next time.
Thanks very much, Erin. As we all know, there's a real push on now here in New Brunswick to get to that magical 75% fully vaccinated, so our economy can reopen and our lives can get back to some semi-state of normalcy. But as employers, this poses some critical questions. What should you consider when developing workplace policies or guidelines for COVID tests or vaccinations? Can you require your employees to get a COVID test or a vaccination before they come to work? We're very fortunate today to have a couple of legal experts to guide us through these questions. Ian Picard is a partner in McGuinness Cooper's Halifax office. He provides advice daily to all kinds of employers across Nova Scotia in all matters relating to human resources, hiring, discipline, and termination. He's a seasoned labor and employment lawyer, and the skill with which Ian conducts his practice has earned him a place on the Best Lawyers in Canada list since 2006. With Ian today is Andrea Williams. Andrea is a labor and employment lawyer based in the St. John's, Newfoundland and Labrador office of McGuinness Cooper. Andrea practices primarily in the area of management side labor and employment law. Her legal practice involves advocating for and advising employers on matters such as labor standards, human rights, wrongful dismissals, and labor relations matters. So Ian and Andrea together advise and represent both unionized and non-unionized employers in all workplace issues, including hiring, discipline, workplace policy development, implementation and enforcement, collective bargaining, occupational health and safety, and termination. And that is quite a long list. So as you can see, we're in very good hands today on this topic. Avant de vous présenter notre prochain conférencier, je veux vous rappeler que vous pouvez poser une question et tout moment pendant la présentation, on utilise la fonction chat ou Q&A au bas de l'écran Zoom. I wanted everyone to know that you can post a question at any time during the presentation by using the Q&A function at the bottom of the Zoom screen, and we'll get to as many questions as time allows at the end of this hour. So that's enough of the pre-talk. Let's get to the heart of today's presentation. And I'll now turn the microphone over to Ian and Andrea.
Okay, thank you very much, John. Andrea and I are certainly very pleased to have the opportunity to do this morning for the Chamber of Commerce for Greater Moncton. Certainly back in February of 2020, neither Andrea nor I knew anything about COVID or the COVID rules as they relate to employers, and it's been a real learning curve for management side lawyers to deal with all of the issues that have arisen as a result of COVID. In some ways, it's been challenging, but also something new and different, so exciting in that way. Now, currently, we're dealing with all the questions around COVID testing and vaccinations for employees and what employers can do in that regard. Andrea and I have had the opportunity to present this this slide deck on various occasions in various different municipalities and provinces, and it certainly this certainly generates lots of questions around mandatory testing and vaccination. So, as John said, we'll be happy to answer your questions at the end of the presentation, as many as we can. But with that, I will turn it over to Andrea to set the baseline for how we can best determine how courts and arbitrators will deal with these difficult questions. Thank you.
Thanks, Ian. So as Ian mentioned, my name is Andrea Williams, and I'm an associate practicing labor and employment in our St. John's office. As I was preparing for this presentation yesterday, I thought back to the last time Ian and I had done this presentation, and it was about a month ago in late April, early May. And it's crazy to think of how much things have changed even in that time frame. So previous times we've done this presentation, we're very much speaking of vaccinations in the hypothetical, when they become available. And it's very exciting to think that we're finally at the point now where many people are across the country are eligible to get their vaccines. And it certainly speaks to just how rapidly things evolve with COVID-19. For in the sake of a month, things can change. So from an employer's point of view, that new normal that we've been talking about and chasing for over a year now seems to be finally in sight. And I believe everyone is hopeful that in the coming months we'll be able to return to some sense of normalcy. So what Ian and I hope to be able to do today is provide you with some background information and guidance with respect to COVID-19 testing and vaccinations as we return to the new normal in the workplace. So perhaps the biggest question of the day is, as an employer, can I mandate COVID-19 testing and vaccination in the workplace? And the answer to that is a qualified yes. Yes, you can. As an employer, you are able to create policies surrounding COVID-19 testing and vaccination. But what that policy will look like, of course, depends on the nature of your operations and the business environment in which you operate. So what we mean by that is one size does not fit all. And in creating this policy, it is, of course, important to reflect on your operations and what it is that you're seeking to achieve with a COVID-19 testing or vaccination policy. So in doing that reflection, the first thing to do is look internally into your organization. So what is the nature of your business or industry? Do you work in primarily the healthcare sector, technology sector? Is it possible for employees to work remotely? Do employees work in close proximity with one another? Things of that nature. Also, for employers working in unionized environments, what does the current collective agreement state with respect to employer policies? Or does the collective agreement itself address things such as employee health data or vaccinations? So in creating this policy, it is certainly important to reflect on the collective agreement to see if there's any guidance provided by that document. In addition, it's also important to look at other unique factors that may be of specific importance as it relates to COVID-19. So one thing that we've encountered with some clients are those clients that operate in communities that are predominantly Indigenous communities, as we know that Indigenous persons are particularly vulnerable to COVID-19. So such factors certainly come into play on what the reasonableness of a COVID-19 vaccination or testing policy. Of course, these internal factors must also be balanced against external factors, being the legal landscape that we currently find ourselves in. So that being privacy law, specifically as it relates to employee medical information, as well as applicable legislation such as public health legislation, occupational health and safety, and human rights legislation. We can also look at an analogous case law. So currently there are no cases with respect to the implementation of a COVID-19 testing or vaccination policy, I should say, but we can certainly find some guidance as it relates to employers who have created policies with respect to the influenza vaccine. So looking at the legal landscape, the legislation that we find ourselves in, one of the most important pieces of legislation is certainly public health legislation. So in New Brunswick, the Public Health Act permits the medical officer to create certain measures to prevent the spread of disease. And I'm sure most are well aware of those measures, being stay-at-home orders, closures of businesses, capacity regulations, and things of that nature. It's also important to note that Section 68 of the Public Health Act in New Brunswick gives the Lieutenant Governor in Council the power to make regulations regarding the vaccinations of residents in New Brunswick. So while vaccinations are currently voluntary in nature, this power is contained in the Public Health Act. Right now, there has been fairly good uptake of vaccinations across the country. So there hasn't been a need to mandate it, but it's certainly important to be aware of this power. Comparatively, in Newfoundland and Labrador, our chief medical officer does not have this power. And in fact, our legislation was amended just prior to the pandemic to remove this power from the chief medical officer. That said, vaccinations are generally seen as a fairly invasive procedure. So consent is currently required, and there hasn't been any movement towards mandatory vaccinations. We must also look at occupational health and safety legislation. So this legislation imposes a legal duty on employers to take measures that are reasonably practicable to create a safe work environment. And of course, what measures are deemed to be reasonable in the circumstance depend on the nature of the operation. So it is important to reflect on the nature of your operations and take measures to ensure the health and safety of your employees. Turning now to the case law. So I'm sure, as you've heard before, that we're living in unprecedented times, and that also means that there's no real legal precedent for COVID-19 vaccination policies, but the case law is developing, and we certainly expect to see more case law in the near future, certainly as employers start to implement COVID-19 vaccination policies, and unions will inevitably grieve those policies, and hopefully we'll get some useful case law as it relates to COVID-19 vaccinations. That said, there are cases out there that can help guide us in determining what approach a court and or an arbitrator will take in looking at the reasonableness of a vaccination policy. So the leading case in Newfoundland and Labrador on the reasonableness of COVID-19 precautions is Taylor in Newfoundland and Labrador. So this was a case that challenged the travel restrictions in the province. So for those of you who are not aware, at the outset of the COVID-19 pandemic, Newfoundland and Labrador imposed stringent travel restrictions to the province, meaning that those who entered the province had to isolate for 14 days, but before they were even allowed to enter the province, individuals entering who are non-residents had to apply for an exemption. So you had to get approval to enter the province, and then once in, had to isolate for 14 days. So the applicant in this case, Taylor, was of course denied entry into the province and challenged this as an infringement of her mobility rights under the charter. This of course went to court, and Justice Burge for the Supreme Court of Newfoundland and Labrador upheld the travel requirement, While he found that this was, of course, an infringement on her mobility rights, it was a reasonable limitation under the Charter, as the applicant's right to mobility must give way to the common good. So in this decision, Justice Burge actually refers to mandatory vaccinations to help inform that balancing of individual rights versus the common good. So he refers to mandatory vaccinations in the context of the smallpox vaccination. And he said, in response to the argument that compulsory vaccination is hostile to the inherent right of every free man to care for his own body and health in such a way as to him seems best, the court observed that real liberty could not exist in a circumstance where each individual operates regardless of the injury that may be done to others. And there are manifold restraints to which each person is necessarily subject for the common good. So in this decision, we get some guidance from the court on their approach to balancing the common good versus individual rights in the context of COVID-19. So certainly this decision, while not relevant to employer vaccination policies, does provide us some guidance on the court's balancing of those rights. The next case that we should be mindful of is the KVP decision. So this is a decision that's well known to those in the labor relations world and looks at the enforceability of a rule or policy that is unilaterally imposed by management. So this is the KVP decision outlines 6 criteria that looks at the reasonableness of an employer policy. So a policy must not be inconsistent with the collective agreement. It must not be unreasonable. The policy must be clear and unequivocal. It must be communicated in advance. Employees must be provided notice of the consequences for a breach, and it must be consistently enforced. As stated, while there's no case law with respect to COVID-19 vaccinations, we certainly expect some in the near future, but as of yesterday evening, no decision has been published in this regard. So as lawyers, we can take guidance from the case law with respect to influenza vaccination. So I'll give you a brief rundown of some of these cases, as it provides some insight as to the approach that arbitrators take, specifically with respect to the balancing of interests. So the first decision is Trilham Ridge Retirement Home, and this is a 1998 decision out of Ontario, whereby the employer implemented a mandatory policy requiring that staff either be vaccinated, take antiviral medication, or miss shifts until immunity could be acquired during an outbreak of influenza in the retirement home. In this decision, the arbitrator upheld this policy as reasonable and found that there was ample evidence to show that the vaccination of staff and residents was an effective means in preventing the transmission of influenza. The arbitrator noted that since the evidence substantiated that the disease or influenza was transmissible even when employees weren't necessarily showing symptoms, simply requiring employees to stay home if they were unwell was not sufficient. And we certainly understand that to be the case with COVID-19 as well. In this case, the arbitrator also noted that the employer's policy was not mandatory in the sense that employees were not forced to get the vaccine. They were permitted to refuse, but such employees would not be allowed to enter the workplace until herd immunity could be established. So therefore, it was not disciplinary in nature, as employees were provided with alternatives and would not be disciplined for refusing to vaccinate. The next case is the Chinook Health decision, and that's a 2002 decision out of Alberta. This was an employer policy that provided unimmunized staff would be placed on leave without pay, but the employer stated that these employees could use sick leave, unpaid leave, or vacation to offset any financial burden. This policy also excluded employees who had demonstrated that they had allergies to the vaccine or were otherwise unable to get it for health, medical, and or religious reasons. In this case, the arbitrator employed a balancing of interests approach and found that the interest of protecting the elderly and vulnerable patients of the Chinook Health region outweighed the employees' privacy rights in this circumstance. So they found that the policy was in fact reasonable. The third decision is the Health Employers Association of BC decision. So this is a more recent decision in 2013. In this case, the employer implemented a vaccinate or mask policy, and that's pretty self-explanatory. Employees had the option of either providing proof of vaccination or wearing a mask during an influenza outbreak. The arbitrator found this policy to be reasonable and again employed a balancing of interest approach in balancing the interests of patient safety during an influenza outbreak against employee privacy. Finally, Alberta Health Services. This is a 2020 decision. It's important to note that this is an early 2020 decision, meaning that it was decided in advance of the COVID-19 being declared a pandemic. I believe the decision was January or February. In this decision, the griever was a nurse who had been exposed to measles. And as a result of this exposure, she was placed on unpaid leave until she could provide proof of vaccination. As a result, the griever exhausted her sick leave and had lost some wages and benefits as a result. In this case, they found that management was able to restrict the employee from work. The policy itself was reasonable. However, the employer had made changes to the policy and had not effectively communicated these changes to the employee. So the arbitrator in this case found that the employer was not able to enforce these changes. So this case also highlights the importance of those KVP principles, meaning that in order for a policy to be reasonable, the policy itself and the consequences for failure to comply with the policy must be clearly communicated to employees. So looking at these cases, we see a few common themes. The first is that all these cases involve the healthcare sector. So this is an important consideration, as with the healthcare sector, employees are predominantly dealing with elderly persons or particularly vulnerable patients. Oftentimes in the healthcare sector, there are underlying medical conditions that make patients even more vulnerable to diseases such as influenza or COVID-19. In addition, in all these cases, the arbitrator employed a balancing of interest approach. So this approach involved weighing the pros and cons, we'll say, of a vaccination policy, being what is the policy seeking to protect the health and safety of both employees and patients and or residents of the employer, and this is weighed against the employee privacy rights. So it is a very fact-specific analysis that takes into play the employer's operations and what it is the policy is seeking to achieve. Another thing is that all policies that were upheld, vaccinations were not mandatory in the sense that there were options provided, meaning that an employee may not be able to enter the workplace, but they weren't disciplined or terminated for refusing to be vaccinated. The employers provided options, being taking vacation, taking leave, or even wearing a mask to offset the risk of not vaccinating. I think what we'll certainly see in the near future is the predominance of and the use of rapid testing as an option for employees, but it is certainly something to consider if you're implementing a vaccination policy. And finally, in these cases, the arbitrators really focused on the science and efficacy of vaccinations in preventing the spread of influenza. The science for COVID-19 and the COVID-19 vaccine is rapidly evolving. I know we've all seen changes in the science over the past year, from the use of masks to now, even in the last week or two, the latest buzz is the mixing of vaccines, being especially for those who have received AstraZeneca. So as an employer, it's important to be aware of the science and ensure that your policy adequately reflects the latest in COVID-19 medical evidence. Finally, it's important to ensure that your policy also considers accommodations for those that are not able to get the vaccine for medical and or religious considerations. So again, while an employer is legally able to have a vaccination or testing policy, what this policy looks like is highly dependent on the nature of your operations, and there should be some flexibility in allowing options for employees who refuse to vaccinate. With that in mind, that's a high-level overview of the legal landscape that we currently find ourselves in. I'll turn it over to Ian, who will provide some more detail on COVID-19 testing and vaccination policies as it relates to your workplace.
That's that's excellent. Thank you, Andrea. I just before I talk about mandatory COVID testing and mandatory vaccines, the influenza cases that Andrea talked about, I myself and most lawyers who practice in this area certainly are of the view that those cases are the best way to inform ourselves as to what will happen going forward with courts and arbitrators dealing with mandatory vaccinations. And I'm a little bit more blunt on some of these issues, and I think that it's fair to say Atlantic Canada doesn't have any vax or mask cases coming out of influenza issues, but across the country there's two very distinct types of cases that Andrea talked about. In the Western provinces, the arbitrators were very clear to say that the employer's vaccination policies would be determined to be reasonable if the employer was focusing on the safety of its patients and staff and customer base. And number two, if the employees, as Andrea said, if the employees had some type of an option to remain employed for the company, which we'll talk about more as we go, if they chose not to be vaccinated. So whether that was wearing a mask, whether that was some other type of off-ramp, it's the word you'll hear me use a lot in the next few minutes, then the policy was reasonable. So the employee could not be fired for refusing to wear the mask, but there would be a search for alternatives that would meet the employer's obligations. That's the Western case law. So that case law, very positive, I would say, for employers moving forward with this issue. The other competing case law is from Ontario, which in most cases in Ontario, they ruled against the employer, and they said that the employer in these healthcare situations could not have mandatory vaccination policies or a mask or vax policy. And the reason for that is because the science was not conclusive, as Andrea said. So, and I don't believe that that is an issue at all with COVID. Maybe I'm naive or drinking the Kool-Aid, but I don't believe that's an issue at all with COVID. I believe the numbers are extremely staggering to show the once somebody is vaccinated, that the chances of being infected or infecting others is dramatically reduced. So the science is very much in support of the benefits of being vaccinated. So I do not believe the Ontario case law will come into play very much as we move forward. So I just wanted to make those comments because I'm a big believer in what is old is new again, and arbitrators will certainly rely on past case law and courts in non-union situations when deciding on these mandatory policies. So let's start with mandatory testing, and just go to the next slide, Andrea. And the good news is that with mandatory testing, so far the judicial response in Canada has been extremely positive for employers when it comes to COVID-related issues. Most of the cases that I'm aware of have all been favorable to the employer, both dealing with mandatory testing, which I'll come back to, which is this case, but also there's some other cases where in Ontario where employees have been terminated for failing to properly self-isolate when they were supposed to, going to work when they were supposed to be at home on a 14-day isolation, and those types of scenarios. Arbitrators have acted very swiftly to uphold terminations and discipline when the employee is violating safety rules put in place by the government with respect to COVID. So that's a very, very good sign that the courts and arbitrators are going to support employers when dealing with COVID issues. And this Crescent Care nursing home case, again, it's a healthcare sector case, but the employer said that all employees had to undergo mandatory COVID testing every 2 weeks, and the union challenged that as being an unreasonable invasion of privacy, and that the science wasn't clear on various fronts. But the arbitrator upheld the policy as reasonable. The arbitrator said, well, the privacy intrusion is arguably comparable to alcohol and drug cases, testing cases. The factors to be taken into account in order to determine the weight to be given to the need for COVID testing as compared with drug and alcohol testing is not. COVID is novel, its name. Public health authorities are still learning about its symptoms, its transmission, and its long-term effects. What is known is that it's highly infectious and often deadly for the elderly who live in these environments. So the court, based on the KVP test, the arbitrator upheld the mandatory testing as reasonable, and I'm not aware of any situations where mandatory testing has been found to be unreasonable. But as Andrea said off the top, you would need to have a policy in place that deals with your own unique circumstances. It depends upon, when it comes to testing and then later on vaccinations, it depends upon what how your workplace is structured. Are people able to social distance in the workplace? How much interaction do they have with the public, which is why nursing homes and hospitals and healthcare settings are so prevalent in these types of issues. But even any type of business where there's a public interaction moving forward, and particularly public interaction in a way where social distancing is not that easy or simple, then mandatory testing can certainly become a part of the regular framework of a policy going forward. I keep saying the word policy because I do want to be clear that if you as an employer want to move forward with having mandatory testing as part of your new world order, then I would strongly recommend that you have a policy in place. And if you're in a unionized environment, then you're going to have to deal with your union about that, at least have a discussion with them, but you certainly can impose it based on the reasonableness standards. So we'll look at the next slide. So the million dollar question today is mandatory COVID vaccinations, and McGinnis Cooper as a law firm has been very clear on this issue since it came to light shortly after Christmas about what's going to happen with mandatory COVID vaccinations. And as Andrea said, a lot has changed since we first gave this presentation in April. To me, the key factors when you want to talk about mandatory imposing a policy about mandatory COVID vaccination, the key factors are that the vaccination has to be readily and generally available. So before you can tell an employee that they have to be vaccinated before they come to work, they need 1 shot or 2 shots of the vaccination. They have to be able to literally walk down the street and get the vaccine. And we're certainly almost there, if we're not there already, in New Brunswick, where any employee who's told that they need to be vaccinated can get the vaccine very quickly. So that's the number one piece, is before you can start telling somebody they have to be vaccinated or they can't come to work, they have to be able to get the vaccine very, very quickly within a matter of days, which I certainly believe is certainly the case in Atlantic Canada now. Number two is what's the, and which is really the kicker in all this, is what's the impact if the employee says that they don't want to be vaccinated. And so as this issue has evolved, certainly McGuinness Cooper's position, and we've been saying this on all COVID issues since March of 2020, no employee should be terminated on a for-cause basis, fired for lack of a better term, for refusing to get a mandatory for refusing to get the vaccine, even if they don't have a religious basis to refuse. They're just saying, I don't want to get the vaccine. Even if they're in the micro, they think that there's a microchip going to be embedded in them. That even those folks, the anti-vaccination folks, they can say they don't want to get it. And so the question is, what does the employer do in that situation? So where we may differ a little bit than others, being risk adverse, is we say you cannot fire them. However, we do believe that this is where my use of the off-ramp expression comes in. We do very strongly believe that your policy can create off-ramps. They can be told to, obviously they can be told to work from home if that's a possibility, so that they're not coming to the workplace at all if they're refusing to get a vaccine. So number one, look at alternatives. Are they able to work from home? Many have worked from home for the last number of months. If the type of business you run is not conducive to them working from home, then that's completely fair game, so that option's out. Then you look at items like vacation leave, time in lieu, other opportunities where they could be paid but not come to work until we get to the herd immunity situation in New Brunswick, where whatever the number is, 80% of the population is doubly vaccinated. These people would be told that they wouldn't be able to work until that situation arises. And number three, is that, which your policy would say, is that if 1 and 2 are not options at all, then number 3 is some type of a leave of absence without pay, so that their job is protected, but they're not going to be paid, they're not going to come to work until we reach herd immunity. There's a lot of some pushback from unions and employment and employee side lawyers that's a constructive dismissal and on, but based on the case law that we've just talked about and other reasons, we believe that's a reasonable response by the employer to what is a very difficult situation. In order to succeed in going as far as telling an employee that they have to go without pay if they're refusing to get vaccinated, is to make sure that your workplace is actually a workplace that is at risk. So a workplace where they're not able to maintain proper social distancing, where they're interacting with the public or they're interacting in close proximity to coworkers. So any type of hospitality, public-facing business, dealing with clients and customers on a regular basis, any type of business like that can have a mandatory vaccination policy. And then the one issue that we were just talking about with John when we were waiting to start this morning, the fourth part of the policy, which goes back to the influenza cases, which was the mask or vax, is you would once rapid testing is readily available, which is very, very soon, like in a matter of days, if not a week or two, where we're going to have access as employers to mandatory testing kits. Then the employee can agree, if they don't want to be vaccinated, they can agree to be tested every morning as part of the off-ramp scenario. So every morning when they come to work, prior to coming into the building or doing it at home or the night before, they can be tested. Because I really believe, speaking personally, that the way the world will evolve in the next 1 to 6 months is that everybody's going to have an option of being doubly vaccinated, which gives them a free pass, or you're going to have to agree to be tested on a daily basis, or anytime you want to go into a business or a place of or an airport or what have you, you're going to have to agree to be tested. So that's the other aspect of this is if you have employees who are refusing to be refusing to be vaccinated, then one of the parts of the off-ramp can be that they would agree to be undergo a rapid test on a regular basis. That's not as perfect in any way as being doubly vaccinated, but it certainly provides another option for you and the employee in that context. So I expect that's the information that you all wanted by joining this call. So we can just go to the next slide, or 2 slides more, I think. There we go. No, sorry. Here we go. Thank you, Andrea. So no, one more. Sorry. So the general rule is that we can't mandate it in the way that I've talked about with discipline for refusal. And the one thing that Andrea mentioned, which I have to come back to, is we have to compartmentalize people who cannot be vaccinated for medical reasons or human rights reasons. I don't really think it changes the landscape a whole lot, as long as you still apply those 4 options that I gave you as your backup options. But I do believe that you're going to need to have a robust vaccination policy very quickly if you want to go in this direction. So we'll go to the next slide. So the do's and don'ts is that first of all, you have to look at your own workplace. I don't want a small I don't want a regular size office that doesn't interact with the public at all, and that has proper social distancing to come out with a very robust policy. Your policy has to fit your environment, and the keys to that are how close are the employees working together, and how close, and what's the risk to the customer base. Obviously, healthcare at one end of that spectrum, where obviously the residents are very vulnerable, the patients, and then in the middle ground you have any type of public-facing business where you're interacting with the public. That's when you need your employees to be vaccinated. You have to respect the duty to accommodate. You got to respect private health information. I do believe, though, that, and some of you may be wondering about this, I'm very quick to say that employees are obligated to tell you whether or not they've been vaccinated. Everybody in Atlantic Canada certainly has a card or an email that they get from their provincial government that tells them how many vaccines that they have. Your employee has to share that information with you if they're telling you that they've been vaccinated. This slide says discipline for non-compliance. That doesn't mean discipline for failure to be vaccinated or get tested. That means discipline for failure to provide you with the information to support the vaccination. It means discipline for failure to pick one of the options that you would have in your policy. It's discipline for failure to adhere to the particulars of the policy, not being terminated for cause for not being vaccinated. And as I said, if you have a union, you should consult with the union in advance. So I believe that might be the last slide. Yes. So with that, we're certainly happy to answer any questions. But to me, the key takeaway is absolutely have a policy. Absolutely consider whether mandatory vaccinations are proper for your workplace, but put in place the off ramps that I talked about if you want your policy to succeed.
Thanks very much.
Thank you very much,
Ian and Andrea, for that very comprehensive overview. It is now time for the Q&A section. We've got about 15 minutes left. So I'd encourage you to put your question using the Q&A function at the bottom of the screen. And we already have a few come in, and I've jotted down a few myself if we have time. So we'll get right to those. The first question asks, assuming our workplace does not impose mandatory vaccinations, but requires our staff to notify us of vaccine status, are we under any obligation to verify or obtain proof of vaccination? thinking of a case where maybe somebody was to lie about getting vaccinated and then contracts COVID or transmits it at work?
Yeah, so there's another question further down that's very similar that says, can we ask for proof of vaccine if we write a policy? So as far as Megan's question goes, if you don't have a mandatory vaccination policy in your workplace and you're not requiring people to be vaccinated, then you would have no obligation to verify whether they've been vaccinated or not. It's only if you have a policy, which is the other question. It's only if you have a policy and you've told the employees that they have to be vaccinated to come to work that you can then require them to prove to you that they've been vaccinated. But if you're just going to play this as not imposing it, then you wouldn't have the requirement to do it. But as I say all the time, though, if you're asking your staff a question on any issue and you're concerned about their answer, then you can seek proof of the answer. So if you think they're lying, then you definitely should seek proof of the answer.
Ian, next one, can you discuss the risks to an employer of not putting policies in place to require testing and/or vaccinations? Would this be considered negligent?
Andrea, do you want to answer that one?
Yeah, absolutely. So as we discussed, what is reasonable in the circumstance, of course, depends on the nature of your organization. Whether or not a failure to put a vaccination or testing policy in place, whether this is considered negligent, certainly depends on the other measures that you have in place in your work environment. From an employer's point of view, if you're allowing physical distancing, if employees are able to, are not interacting with members of the public, then certainly not putting a testing or vaccination policy in place would not be considered negligent in those specific circumstances. It depends on, certainly it's a weighing of the risks that that you see in the workplace and what other measures are being put into place to mitigate the risk of the risks to health and safety of your workforce.
Great, thank you.
We've heard a lot about vaccination rates in long-term care homes, and so a question asks, if there is a legal case to make vaccines mandatory in certain settings, why haven't we seen that in the healthcare sector?
Yeah, I mean that's a great question. I mean, I do think there's a lot of debate in Ontario and elsewhere about mandatory vaccines in the healthcare sector. But I mean, I've had that question before and heard others ask it and answer it. And I think the best answer is kind of what you alluded to, John, is that the vaccination levels in the healthcare sector are very, very high. Both among the patient population or the resident population and the staff. At least in Nova Scotia, they're well up over 90%. So once you're already there in that 90% or high 80% window, then I guess the employers are just not pushing the envelope to say that vaccinations are mandatory for the other 10%. A lot of the questions that we're getting here are about herd immunity and whether it's in the workplace or in the community at large, and certainly in the healthcare sector, within a hospital or a nursing home, it's within the building itself. So if 90% of the people in the building are vaccinated, fully vaccinated, and including the residents and the patients, then it may not be necessary to really pick a fight or push the envelope with the other 10% or less of the employee group in that scenario. But I don't believe you're going to see those same numbers in the hospitality industry or with bars and restaurants or with public-facing businesses, which is where this question becomes much more difficult.
Somebody's asked, would this type of policy apply to volunteers who may work in a sort of mixed paid staff volunteer environment?
Yeah, I'll let Andrea take that one. Thanks.
Absolutely. So an employer's obligations with respect to occupational health and safety apply to all those in those workplaces. So from an employer's point of view, they have to take measures to protect volunteers as well as paid employees. With respect, if having a volunteer unvaccinated in the mixed environment would pose a risk to your employees, well, then the policy may certainly apply to them as well. In addition, the risk of any constructive dismissal claim for a volunteer will be dramatically less, as a volunteer on unpaid leave is no different, as you're not obligated to pay them when they are in the workplace as well.
There's a question here about balancing the rights of vaccinated employees versus non-vaccinated employees in the workplace. You know, a vaccinated employee would like to work from home, but may not be allowed to, while the non-vaccinated employee gets to work from home because he or she has chosen not to get the vaccine. How do you balance those realities?
Yeah, no, that's a great question, and I'm glad it got asked, because I don't want to leave you with the impression that any employee has the right to work from home. So if your business is not is wanting all employees to be at work, and so vaccinated employee who wants to work from home isn't allowed to, then you don't have to allow the non-vaccinated employee to work from home. You can move to the other options that I gave you of testing and or a leave of absence without pay. If you're concerned about employee morale and some being able to work from home and not, and it being seen as a benefit to not get vaccinated so you can work from home, you don't have to allow that at all. It's completely up to the employer, and it has been since the very start of this, as to whether an employee working from home is a benefit to the business. So that's a great question, and you don't have to allow that employee to do that. You can move to the other options, the other off-ramps that I gave you.
Mm-hmm. As you mentioned,
I'll just build on that in saying that while in looking at the employee working from home, it's important to understand why they aren't at home. As Ian mentioned, if they're simply choosing not to work from home because they refuse to get the vaccination and prefer to work from home, that is, of course, the employer's choice. However, if an employee is unable to get the vaccine due to medical reasons or religious beliefs or any other human rights consideration, well, then allowing that employee to work from home may very well be a reasonable accommodation to the vaccination policy.
Mm-hmm. There were, as you mentioned, Ian, a couple of questions around herd immunity, and I think you answered them, that in this context, herd immunity would apply to the workplace as opposed to the general population.
Yeah, there's a great question here about employees at my resale store are vaccinated at present near 30% versus the province at 70%. That's a situation where, New Brunswick is opening rapidly, that you're certainly going to have to come up with a way to increase your vaccination numbers within your employee group, and mandate those vaccines in the way that we talked about to get those numbers up. And the only way you would stop is when your employee group is vaccinated to the 80% or 85% level. And then within your building, then you have the necessary protections, which is my comment about the healthcare sector. Mm-hmm. Dealing with the public is a whole other thing. There's another question here about what about customers or clients. I mean, you hate to rely on the U.S., but in the States right now, you can just see by watching the hockey or the basketball on TV that they are very much dealing with vaccinated people dealing different than non-vaccinated people, right? There's some arenas are only allowing vaccinated people in. Some arenas are seating them elsewhere, and general businesses in the U.S. are doing the same thing. So we certainly are going to get to a place where you can talk about whether or not a customer is vaccinated, because it's a private business. If you're working for in the private sector, the public sector is somewhat different. But if you're working in the private sector, it's a private business. You can make your own decisions about who's allowed in your store when it comes to whether they've been vaccinated or whether they're prepared to undergo a rapid test. Those are or will all be fair game until such time as we get to herd immunity within the general population.
There's a question here. We have time for a couple of more. From an HR perspective, are employers able to ask staff if they've been vaccinated if they're in a low-risk environment? Is there any difference in terms of policy that needs to be in place?
Yeah, I'll let Andrea answer that one. Thanks.
Yeah, absolutely. With respect to the question of would a policy need to be in place, our advice is always it's better to have it in writing. If there's any ambiguity, it's certainly beneficial to be proactive and put a policy in place. With respect to a low risk environment, again, this comes to the balancing of interests. Exactly what information are you asking for? If it seemed to be reasonable, then you are certainly able to ask staff if they have been vaccinated, and certainly with respect to lowering any COVID-19 precautions that are currently in the workplace. But with that, we always say that it's important to have it outlined in a policy so that the employee knows exactly what information is being requested of them, and that information is medical information and will be kept confidential with the employer.
Here's an interesting question. Are there any issues with using incentives to increase vaccination rates in the workplace? We've heard everything from free beer, maybe not in the workplace, to days off.
Yeah, so that depends on whether you're union or non-union. In a non-union environment, there certainly is no issue with using an incentive to have your employees be vaccinated in any type of work environment. How you incentivize or what you incentivize for is completely up to you. But in a unionized environment, there is the issue of the collective agreement and having to make sure you deal with the bargaining unit. So if you're in a unionized workplace, you're going to have to talk to the union about that and see whether they agree or don't. And you wouldn't be able to put it in place unless the union was in favor of it, because it would be a monetary issue that the union may not be in favor of. And I don't want to complicate it, but I also would say that if you use an incentive to try to increase vaccination rates in your workplace, you have to be cautious of the person who, for health reasons, cannot be vaccinated and how you're going to deal with that person, because I don't want them not to get a lollipop because they have medical issues that don't allow them to be vaccinated. So you're going to have to be cautious as to how you deal with that issue. Whether they get a lollipop, is fair game. But I just don't want you to make a big thing about it and then have somebody who's medically unable to get the vaccine or religious reasons, and then have that sort of blowback in your face. So you need to think that one through. And I will just answer the last one because I've answered it many times. Jody answers, will this always be an issue for employers, or will government eventually mandate vaccines? The Canadian government and no provincial government in Canada is ever going to mandate vaccines. It's too much of a hot political football. So there's charter issues, there's all sorts of issues dealing with people's freedom. And so that's never going to happen, in my opinion. So this is always going to be an issue for employers to manage at the employer level. But I do believe it's a 6 month issue, or 3 month to 6 month issue, because once we get to the majority of the population being vaccinated, we're not going to have these issues anymore.
Okay, that's a great question, I think, to end on, Ian. And I know we could go on. I didn't get to my own questions, but I'll save them. Maybe I'll send them to you by email.
Happy to do that.
Okay.
Very much so.
So thanks very much to Ian Picard and Andrea Williams of McGuinness Cooper for delivering really valuable and timely information today on this important topic. And I should point out, Ian and Andrea, that our own chair of our board, Greg McLean of McGuinness Cooper here in Moncton, is on the call today listening in. So appreciate Greg's participation.
Yeah, we were happy to do this when Greg reached out to us. So that's excellent. Thank you.
Great. Avant de terminer la séance d'aujourd'hui, je tiens à mentionner que notre prochain atelier de matin aura lieu le 23 juin à 8 heures. So before I close today's session, I just want to mention our next Breakfast and Learn is June 23rd at 8 a.m. The topic will be Ready for Business, Accessing the Value of Experiential Learning. And also upcoming is a session as part of our Recovery Road Economic Recovery Series on June 17th, featuring Tim Porter and Jordan O'Brien of Porter O'Brien Associates, speaking on how to work with and lobby government, which has never been more important than the last 15 months. Also, don't forget, registrations are now open for our annual Chamber Golf Tournament to be held August 19th at Royal Oaks. And nominations are also open for our annual Business Excellence Awards to be presented October 20th. You can check our website, ccgm.ca, for all the information on upcoming events. So to close off, thanks again very much, Ian and Andrea McGinnis Cooper, for joining us today. And thanks to everyone who tuned in. We had great attendance. Merci de vous être rejoints à nous. Please stay safe. Let's get to green. And we hope to see everyone again soon, live and in person. Bye for now.
Thank you very much.
Thanks so much.
Bye now.